The needle went in on the second breath. Riley Hart felt the rise of the chest through latex and cotton-counted ribs under gloved fingertips, then slid the needle between the fifth and sixth. The skin was cool with sweat. The muscle pushed back for a heartbeat, then gave way. She kept her eyes on the monitor. A flat green line, one long tone. The trauma bay felt smaller than it had 5 minutes ago. Too many bodies, too much air that did not move. The fluorescent lights hummed. Someone's cologne sat under the stronger smells of antiseptic and copper. "You are too low," Dr. Stephen Cole said. His voice came from her right shoulder, tight frayed. "Heart, pull back. He is gone." The man on the table did not look like a colonel now. The uniform coat was cut away, silver eagles tossed onto a tray chest covered in betadine and blood. The name patch with Harlow sat at the edge of the field, bent and wet. Riley ignored Cole. She changed the angle of her wrist a few degrees toward the left shoulder. Her thumb steadied the hub of the needle. Her other hand lay flat on Colonel Daniel Harlow's sternum, feeling nothing at all. "Stop," Cole snapped. "I said stop. He has been down 8 minutes. We are calling it." "That is not your call yet," Riley said quietly. The tip of the needle slipped forward. She felt a soft pop, a tiny letting go that she knew better than her own pulse. The syringe filled first with nothing, then with a trickle of dark fluid that swirled against the plastic. "Pericardial blood." "Bag him," Riley said. Jordan Vega was already at the head of the bed, hands on the bag valve, mask eyes wide and fixed on Riley. The medic's face was streaked with sweat and a line of dried blood across one cheek. "On it," Jordan said, voice low. Riley pulled back on the plunger. 10 milliliters? 20? The blood came slow but steady. The soft sack around the colonel's heart eased its grip with each milliliter. The monitor did not care. The flat tone did not change. "Hart," Cole said, "you do not have authorization for this procedure. If you do not step away right now, I will have you removed." "Do you hear me?" Riley kept drawing until the syringe hit 40. Only then did she withdraw the needle smooth and straight. She dropped it into Jordan's waiting kidney basin without looking, then placed both hands on the colonel's breastbone. The tone on the monitor went silent. For a half second, the room had no sound at all. No orders, no beeps, only the faint hiss of the air conditioning. Then Riley started compressions. Hard, fast, 2 inches deep. Her shoulders stacked over her wrists. Pressure drove through bone and cartilage and tangled muscle memory. She counted under her breath, not numbers, but beats. A paramedic at the foot of the bed swallowed hard. Leah Grant, senior resident, watched from the other side, one hand on an IV line that hung useless for the moment. "He has been down 14, someone said. It might have been Ethan Park. Protocol says we stop." No one moved to stop her. The colonel's head rolled slightly with each compression. His mouth hung open, lips tinged blue-gray. His eyes were closed. His dog tags lay in a small pile of stainless steel on the counter by the wall. Riley did not look at any of it. She watched the empty line on the monitor. The green glow burned a thin stripe across the screen. Her hands rose and fell in a rhythm that felt older than this room, older than this hospital in the middle of Phoenix, older than the desert outside. "Come on," she said not loudly. "Remember." The monitor stayed silent. She pressed again. The smell of alcohol and sweat and fresh gauze shifted with her movement. The cotton of her scrub top clung at the back of her neck. She heard Leah's breath catch, heard Jordan count breaths in between compressions, heard Cole take a step back. Riley did not feel any of it in her hands. She pressed and waited for the heart under her palms to decide whether it was finished. 6 hours earlier, the doors of St. Augustine Regional Trauma Center opened with a soft hiss and let the heat in. The parking lot outside shimmered under the Arizona sun. Hot air rolled through the sliding glass for a brief moment before the air conditioning pushed it back. Inside, the world smelled like bleach, instant coffee, and plastic. Riley walked through the doorway with her shoulders relaxed and her chin level. Her navy scrubs hung loose at the neck. Her ID badge clipped to her hip swung once, bounced off the seam of her pocket, then settled. She carried a stainless steel travel mug in one hand. Her other hand was empty. No backpack, no lunchbox, nothing extra that would suggest she planned to stay longer than the shift on the schedule. At the nurse's station, a tech looked up from a computer and nodded. "Afternoon, Hart." "Afternoon," Riley said. She signed in on the paper log even though there was a digital system. Her handwriting was small and even, each letter sitting exactly inside the lines, no loops that reached past the margin. Behind her, monitors beeped at steady intervals. Somewhere down the hall, someone laughed, the sound cut short by a closing door. From the trauma bay, a voice that belonged on a microphone not in a hospital carried. "Lap Cole got moved to 4. The appendectomy is still in 3. Who is my nurse in 3? Riley set the pen down. At the whiteboard, Dr. Stephen Cole stood with a dry erase marker in one hand and authority in the other. His hair had gone silver at the temples in clean lines that matched the crease in his trousers. He wore his stethoscope like part of the uniform. Two residents flanked him back slightly straighter just because they were near him. Leah Grant held a clipboard full of notes pen tapping against the top ring. Ethan Park leaned in, eager, nodding too fast. Riley stepped behind Cole to reach for the day's trauma list. The fabric of his coat brushed her sleeve. She caught the faint scent of aftershave under the sharper smell of alcohol wipes. Cole did not turn around. He did not have to. "Nurse station is that way," he said, flicking the marker casually toward the opposite end of the hall. "Coffee is back there too, if that is what you're hunting." Ethan smiled into his chart. Priya Desai bit the inside of her cheek and looked down. Riley paused for a single breath. "Just grabbing the trauma board, doctor," she said. Her voice was even, no heat, no apology. For a moment, Cole's reflection stared back at her from the glass of the board. His gaze slid past her face to the name tags clipped to her chest. She saw the tiny shift in focus, the quick calculation. RN, not MD. He nodded once, not quite at her. "Try not to rearrange my instruments while you are at it," he said. "We had that problem last month." Riley took the board. Her fingers curled around the plastic frame knuckles, white for a heartbeat, then relaxed. She read the list of incoming transfers without moving her lips. At the edge of the nurse's station, Jordan Vega watched Riley walk away. The former Army medic's eyes followed the way Riley moved through the crowded hallway without bumping anyone, the way she turned sideways just enough to let a gurney pass, the way her hands stayed loose and ready at her sides. Jordan sipped lukewarm coffee and frowned, trying to place why that line of movement felt familiar. Somewhere far away, a memory of a tan canvas tent and a woman shouting over mortar fire tugged at the back of her mind. Riley stopped at the scrub sink. She set the travel mug on the counter, rolled her sleeves to her elbows, and opened the faucet. Hot water hammered against her skin. She turned her hands under the stream fingers, flattening palms up, palms down. Her forearms were pale from the middle outskin, a shade lighter where long sleeves and gloves had spared it from the desert sun. A thin, white scar ran along her right forearm, straight and fine, the length of a thumb. She glanced at it once. Then she laced her fingers together under the water and scrubbed, counting quietly in her head. Not seconds. Step, room, bed, patient. When she finished, she dried her hands carefully and pulled the sleeves down again until the scar vanished under navy cotton. In trauma, the first monitor on the left beeped in a slow, steady rhythm. Riley picked up her mug, squared her shoulders, and walked toward the sound. By 3 p.m, the hospital had settled into its uneasy rhythm. Not quiet, not loud, just the kind of steady noise that made it hard to tell where one emergency ended and another began. Riley stood at the central desk while the charge nurse ran down assignments. Clipboards swapped hands. Names moved from whiteboard to whiteboard. "Or 3 needs a scrub nurse for an appendectomy," the charge nurse said. "Cole is lead. Park is first assist. Hart, you are in there." Riley nodded once. She set her mug on a shelf behind the station and took a cap and mask from the dispenser. The walk to the operating wing was short and cool, a corridor lined with framed photos of smiling surgeons and check presentations. Fluorescent light bled into every corner. Inside the locker area, she changed into fresh scrubs and shoe covers, tied her hair back under the cap, and washed again. The scar on her forearm flashed white and disappeared under the fabric when she rolled her sleeves down. Or 3 waited with its door propped open. The room smelled like disinfectant and plastic. Stacks of blue drapes sat folded on trays. A metal table waited for instruments under a sterile cover. Riley moved straight to the back counter. She opened the instrument tray and laid each piece down in a strict order that lived in her muscles. Scalpels, clamps, needle drivers, suction tips, retractors. She aligned them by size, by use, by reach, so that a hand could find what it needed without looking. Jordan Vega came in pushing a tray of sterile packs. There was a hair tie looped around her wrist and a smudge of ink on her name badge. She watched Riley work her brows, drawing together. "You color-coding them in your head too?" Jordan asked. Riley did not look up. "Something like that." "You set them like this in school, or is this an Army thing?" Riley paused for just a fraction of a second. "Does it matter?" she said. Jordan opened her mouth, then shut it when the anesthesiologist stepped in with the patient. The man on the gurney looked too young to be on an operating table. Early 30s, hair tied in a loose knot, faded tattoo, half hidden under the flimsy gown. He tried to make a joke and then winced at the pain in his lower right abdomen. "Appendix is angry," the anesthesiologist said, "but we caught it before it burst. Mostly routine. Mostly." Riley helped transfer the patient to the table, checked the position of the arms, adjusted the sheet. Her movements were calm, efficient, careful not to tug at the IV line taped to the back of his hand. When the anesthetic flowed and the man slipped under, the room changed. It became a space of numbers, angles, and tissue. Riley felt her breathing slow to match the sound of the ventilator. Cole entered last gloves, held up mask in place. The silver at his temples was tucked neatly under his cap. He moved with the confidence of someone who knew everyone was watching. "Afternoon, team," he said. "Let us save this man from ever being able to complain about his appendix again." Ethan Park gave a small laugh that no one echoed. Riley held out the gown and gloves so Cole could scrub in fully. When he stepped up to the table, she was already in position at his right, instruments lined up within his reach. "Scalpel," he said. The handle met his palm as the word left his mouth. He cut through skin and subcutaneous fat with steady strokes. The anesthesiologist called out vitals from time to time, a list of numbers that stayed within safe margins. "Clamp," Cole said. The clamp was there. Suction. Riley moved the tip into his field, clearing blood and fluid. He did not have to ask twice for anything. She watched the way his fingers moved, the way his shoulders shifted the sequence of his actions. Her hands moved a half beat ahead. Cole's eyes flicked toward her once. "How are you guessing my steps, Hart?" he asked. "Patterns," she said. "You like to see more than you need to before you cut." Ethan's mouth twitched under his mask. Cole made a non-committal sound that could have been annoyance or agreement. They reached the peritoneum. Cole opened it and moved deeper. The air that rose from the incision carried a faint edge of something sour. Not strong, not overwhelming, just wrong by a fraction. Riley's nose wrinkled under her mask. The light above the table shone white on loops of intestine that did not look quite as pink as they should. There was a pale, almost yellow sheen along the serosa, where healthy tissue would have been bright. On the monitor, the heart rate stayed steady. Blood pressure remained stable. The screens told a calm story. The field did not. Dr. Riley said, keeping her voice level, "There is discoloration along the peritoneum. The smell is off." Cole did not respond right away. His hands continued to work, isolating the appendix with practiced ease. "Could indicate early peritonitis," Riley added. "Might be spread wider than the scan suggested. We could pause and extend imaging, or prepare for irrigation of a larger area." Ethan's eyes shifted between Cole and the operative field. Cole finally looked up from the incision, his gaze fixed on Riley over the top edge of his mask. "Nurse Hart," he said, calm on the surface. "How many appendectomies have you performed?" "Performed or scrubbed in?" Riley asked. "Either." "Scrubbed," she said. "None." "Exactly," Cole said. "The appendix is inflamed but intact. His vitals are normal. We are well within schedule. Your job is to hand me instruments not to expand the scope of this procedure based on a smell." Riley held his gaze for the space of one breath. "Understood," she said. She stepped back half a pace. Her hands did not shake. Her eyes went back to the field. 30 seconds later, when Cole lifted the appendix with a retractor, a small pocket along the cecum ruptured. A thick, yellow fluid spilled into the abdominal cavity. The smell hit harder now, a wave of rot under the scrubbed air. Ethan flinched. "Damn it," Cole muttered. Riley already had the suction in her right hand and a bulb of warm saline in her left. She moved without being told, clearing the pus while keeping the edges of the incision clean. "Irrigation," Cole said late. The bulb was in his hand before he finished the word. He rinsed the area. Ethan followed his lead, trying to catch the runoff. The routine surgery stretched longer, becoming a careful sweep for any sign that the infection had spread. Cole's tone sharpened as he gave orders. No one mentioned that Riley had seen it coming. Finally, he tied off the appendix and removed it. Riley passed a small specimen cup. The inflamed piece of tissue dropped in with a soft sound. "Closure," Cole said. Riley had already threaded the needle. She placed the loaded driver in his palm. He glanced at her but said nothing and began to close layer by layer, neat and fast. Leah appeared at the doorway halfway through the closure. She watched for a minute, arms folded, eyes narrowing on the pattern of the sutures. They were interrupted tension sutures, short and strong, the kind used when tissue might be under stress later. Ethan followed Cole's movements with careful attention. Riley tracked the edges of the wound, anticipating the next pass. When the final knot settled and the last layer of skin was approximated, the incision line looked clean, almost delicate. The smell in the room had mostly faded, replaced by the sharp scent of antiseptic. "Appendix out," the anesthesiologist said. "He will complain more about the food than the pain." Cole stripped off his gloves and dropped them into the biohazard bin. "Good catch on the abscess," Leah said softly, eyes on the field. Cole did not answer. His gaze went to Riley. For a moment she thought he might nod or offer something like acknowledgement. Next time, he said instead, "Keep commentary to yourself until you are asked." Riley inclined her head. "I was trying to keep contamination limited," she said. "And we did," Cole replied, in spite of the running diagnosis from the nurse. "Prep for turnover." He left the room. Ethan followed close behind. Leah stayed a beat longer. "Nice work," she said to no one in particular. Jordan snorted a quiet laugh. Define nice. Riley was already dismantling the instrument table, placing each used piece into the tray for sterilization. Her hands moved with the same careful rhythm they had used to set everything up. Later in the break room, the air was thick with the smell of burned coffee and microwaved leftovers. A small television in the corner played a muted sports channel. The sun through the narrow window had shifted to a harsher angle, making the dust in the air look like it floated in slow motion. Ethan sat at the table with a plastic salad container in front of him, poking at it with a fork more than eating. Priya perched on the edge of a chair, shoes half untied, hair slipping from its bun. Jordan leaned against the counter with her mug. I am telling you, Ethan said she had suction ready before he even saw it. Priya frowned. Maybe she saw something on the scan we missed. There was nothing on the scan, Ethan said. I checked it twice. That abscess was tucked behind. He only found it when he pulled up the appendix. She was already moving. Could be luck, Priya said. Sometimes it is just good timing. Jordan shook her head. You do not get that kind of timing by accident, she said. You learn it somewhere you do not want to go back to. Priya glanced toward the door instinctively, then lowered her voice even though the room was otherwise empty. You think she worked somewhere rough before here? Priya asked. Like a big city trauma center? Jordan looked into her coffee as if it might answer. I have seen those sutures before, she said. And that layout on the tray. My first deployment, the surgeon in the field hospital set up like that. Every time. He used to say if he had to look down to find a clamp, someone died. Ethan raised his eyebrows. And you think Hart is that kind of surgeon? I think she's not just a nurse, Jordan said. And I think Cole knows it. The door opened with a soft click. Riley stepped inside, mask hanging loose at her neck, now, hair a little flattened from the cap. She went straight to the water dispenser, picked up a paper cup, and filled it. Cold water hit the sides of the cup with a dull sound. Conversation at the table stuttered and dropped to a murmur. Ethan looked down at his salad. Priya stared at the condensation on her own cup. Jordan watched Riley's shoulders. Riley did not turn around. She drank half the water in 3 swallows, refilled the cup, and tossed it into the trash. The muscles in her right forearm moved under the fabric of her sleeve, that pale line of scar hidden but still there. As she reached for the door handle, Priya spoke barely audible. Do you think she heard us? Jordan shrugged. She hears more than she lets on, Jordan said. I do not think she cares. Riley stepped out into the hallway. The break room door closed behind her with a soft thud, sealing in the smell of coffee and old food. The hallway smelled like antiseptic again. Far off, a monitor started to beep a little faster. Riley adjusted her grip on her empty hands and walked toward it. The faster beeping turned out to be nothing more dramatic than a teenager with a migraine who had jerked his arm and kinked his IV line. Riley fixed it, adjusted the tape, and watched his heart rate settle back into a steady climb and fall on the monitor. By the time she stepped away from his bed, the overhead lights in the emergency department had warmed from white to a faint amber. Afternoon at St. Augustine meant shift changes, new labs posting, and a fresh set of names on the surgery board. The charge nurse met Riley halfway down the hall. Hart, she said, you are back in the OR. Cole again. Gallbladder this time, or 4. Riley nodded. Got it. She signed the new assignment on the clipboard and turned toward the operating wing. In OR 4, the air felt colder. The lights were already on the table, set monitors humming quietly. A middle-aged woman lay on the gurney, awake but drowsy, hair pulled into a tight gray bun. Her husband stood beside her, fingers curled around the bed rail. They said it is just my gallbladder, the woman said, trying to smile. They do these all the time, right? All the time, Riley said. We will take good care of you. She checked the ID band, the allergy bracelet, the consent. Every line matched. Every box was ticked. Her hands moved over the setup with the same strict order as before. Trocar laparoscope graspers, clip suction. Each instrument had a place, and she put it there. Jordan arrived sliding a tray of extra sutures into place, then stood back to watch. You again, she said. Riley did not smile, but her reply held the shape of one. Me again. The anesthesiologist eased the woman under. Her husband squeezed her hand until the nurse guided him gently out of the room. Cole came in as the nurses finished draping. He scrubbed in without small talk this time, eyes on the monitor that would show the inside of the abdomen in magnified color. Gallstones, he said to the room. 54, no prior surgeries. Textbook. Let us stay on time for once. He made 3 small incisions, placed the trocars, and slid the camera inside. The monitor bloomed with images of pink peritoneum. The liver appeared as a smooth, dark mass. The gallbladder tucked underneath like a swollen green thumb. A thin sheen of fluid glistened along the surfaces. Riley watched the screen, watching for patterns that did not match. The camera panned down to the common bile duct. For a moment, it caught a small bulge at a junction where the duct should have been smooth. Freeze that, Riley said quietly. The tech with the camera glanced toward Cole. Cole did not pause. Keep moving. We have enough to see. Riley kept her gaze on the screen. The duct looked slightly dilated at that junction, she said. Could be a stone lodged there. If we pull the gallbladder without clearing it, she could obstruct after. Cole huffed out a breath. Vitals are stable, he said. Liver looks fine. Trust the imaging heart. He maneuvered the grasper, seized the neck of the gallbladder, and began to separate it from the liver bed. The view shifted. For 3 heartbeats, the bulge disappeared behind a fold of tissue. Riley inhaled through her mask. "Doctor," she said, "right there, behind the wall. That is where it will drop if you're not ready." Cole's shoulders tightened. "Enough," he said. "I can see. There is no obstruction." He cut the cystic artery, clipped the cystic duct, and lifted. As the gallbladder peeled away, something small and pale rolled out from behind it and tumbled into view. It caught the light, flashed once, and settled into a shallow pocket. A stone. Ethan, observing from the corner, made a small choking sound. Cole froze. Silence hung in the room for 1 beat, then 2. "Retrieve the stone," he said finally. Riley had already set a small basket grasper within reach. She passed it into his hand. He snagged the stone, withdrew it carefully, and dropped it into a specimen cup that Riley had opened without being asked. The rest of the procedure went smoothly. The gallbladder came out through one of the port sites, was bagged and labeled. Clips shone silver on the monitor like tiny moons. When Cole finished inspecting the field, he pulled the instruments out and handed them back without comment. The trocars came out. The incisions were closed from the inside out. "Nice save," Dr. Jordan said under her breath as she helped clean up. "Patient is stable," the anesthesiologist said. "No complications." Cole left without looking at Riley. Jordan stayed to help her break down the instruments. She watched Riley's hands. "You saw that stone before he did," Jordan said. Riley placed a grasper into the used tray. "It was a guess," she said. Jordan snorted. "Some gas." Riley washed her hands again and stepped out into the hallway. The corridor had shifted from quiet to tense. Voices overlapped a little sharper than usual. A clerk pressed herself against the wall to let a gurney slide past at speed. A paramedic walked beside it, talking quickly into his radio. "Chest trauma," he said. "Driver's side, no airbag. Breath sounds decreased on the right. Hypotensive en route." He saw Riley and jerked his chin toward Trauma 1. "Bay 1, he said. The intercom crackled overhead. "Trauma team to Bay 1, the operator said. "Trauma team Bay 1. Riley set her shoulders and walked that way. By the time she reached the bay, Cole was already there. Leah stood at the foot of the bed, gloved and gowned. Priya hovered by the medication cart. Monitors were connected. Lines snaked from the patient's arms and the cusp. The man on the bed was in his 50s, gray hair slicked back with sweat and blood. His chest rose unevenly. Deep bruising bloomed along his right ribs. Each breath made a wet sound wrong in its timing. "Seatbelt mark," Leah said. "Pulse 120, pressure 90/60 on arrival." Cole listened to the man's chest with his stethoscope, then thumped lightly along the ribs. "Diminished breath sounds on the right," he said. Trachea slightly deviated. "Likely tension pneumothorax. We are putting in a chest tube before he collapses." He looked up. "Leah, get a tube set. Priya, call for a portable chest x-ray. Heart, you take Bay 2. Stable motor vehicle crash with forearm fracture. Keep them calm and do not crowd my room." Riley did not argue. She moved to Bay 2, where a woman in her 40s clutched her left arm like something precious that might fall off. The wrist was swollen, bruised, obviously broken. Her eyes bounced from the ceiling to the door to Riley's face. "Is that my heart beating so fast?" she asked. "Some of it," Riley said. "Some of it is the monitor. You are safe. Let me get a line started so we can give you something for the pain." She slipped an IV into the woman's uninjured arm with a single smooth motion. The needle slid and the flash of blood appeared, and the catheter seated with a click. Tape tubing a bag hung on a hook. Her hands moved by rote. She kept her ears tuned to Bay 1. Through the thin curtain she heard Cole call for lidocaine, then betadine, then a scalpel. A tray clinked. Leah repeated vitals. The steady beep of the monitor shifted, picking up speed. Over it all, another sound drifted. Not quite a breath, not quite a wheeze. A high whistling note almost like air leaking through a cracked reed. It came with every attempt the patient in Bay 1 made to inhale. Riley's skin prickled. She glanced at her own patient's monitor. Heart rate elevated but tolerable. Blood pressure slightly high, pain not shock. The woman's breathing was fast but clear. She could sit for 30 seconds without help. "Take slow breaths with me," Riley said. "In through your nose, out through your mouth." She stepped to the edge of the curtain and parted it just enough to see. Cole had marked the spot between the ribs on the right side just above the nipple line. The chest tube kit sat open on the tray. Leah stood ready with the suction line. The whistling sound came again. Riley froze. The noise was higher than the lungs. It sat in the throat. It did not time out with the rise and fall of the chest. It cut across it sharp and thin. Dr. Riley said, "That sound is tracheal." Cole did not look at her. "He has a collapsed lung," he said. "I am treating the collapsed lung. Back to your patient." Leah's eyes flicked toward Riley for a second. The monitor in Bay 1 chirped faster. Oxygen saturation numbers edged down. 94, 91, 88. Riley stepped fully into the doorway. If his trachea is fractured, the air's not getting past the obstruction, she said. A chest tube will not help if he cannot pull air through his throat. Cole's jaw tightened under his mask. Nurse Hart, he said, you do not make airway calls. You do not contradict me in my trauma bay. Return to Bay 2. The whistling hit a higher pitch and then cut off entirely. The man's chest moved, but the sound did not follow. His lips darkened at the edges. The pulse on the monitor climbed to 130, then started to stutter. Leah pressed the mask over his mouth and nose and squeezed the bag. The chest rose weakly. Very little air moved. Marcus, she said, voice tight. It is not going in. The bag is not moving air. Cole reached for a laryngoscope. We will intubate, he said. He is still moving air. We have time. Oxygen saturation dipped again, 85, 82. Riley took a step closer to the bed. You do not, she said. Cole snapped his head up. Get out of this room, he said. Now. The monitor screeched an alarm. 79, 76. Leah's eyes met Riley's over the patient's chest. For a moment, everything else in the room blurred. Riley saw the man's neck, the shallow notch between the thyroid cartilage and the cricoid ring. She saw the way his chest strained and failed, the way his fingers curled at the sheets in a blind grip. She moved. It was not a dramatic lunge. It was 2 long strides to the tray at the bedside. Her hand closed around a scalpel. Cole shouted, do not touch him. Riley reached for the front of the patient's neck. Bag, she said. Keep trying. Jordan appeared at her shoulder with a small tracheostomy tube and a bougie eyes wide but steady. Riley found the cricothyroid membrane under her fingertips soft between the cartilage ridges. She pressed the skin down, made a small horizontal cut. Blood welled up bright and quick. Stop, Cole said. You are not authorized. The cut was clean. Riley widened it with the tip of the scalpel, then slid the bougie in through the opening, feeling for the give into the airway. The tube followed along the guide seating into place. Jordan connected the bag to the tube and squeezed. Air moved. The chest rose. The monitor paused in its downward slide. 78, 82, 86. The whistling was gone. The room held its breath and then let it go all at once. Leah sagged half an inch, then straightened. Cole stood with his hands hovering over the field mask, hiding most of his expression. Riley stepped back from the bed. There was blood on her gloves, a thin ribbon on her wrist, where the sleeve had ridden up. Her heart pounded in her ears, but her hands stayed steady. He is ventilating, Leah said. Breath sounds present bilaterally now, oxygen coming up. Cole turned to Riley. You are done, he said, voice low and shaking. You are suspended effective immediately. Hand over your badge and get out of my trauma bay. Riley stripped off her gloves and dropped them into the biohazard bin. The pale scar on her forearm flashed in the harsh light. She unclipped her badge and set it on the nearest counter. He is breathing, she said. That is not the point, Cole replied. Riley looked at the man on the bed. His chest rose and fell under the mask. The numbers on the monitor climbed slow but sure. It is to him, she said. Then she turned and walked out of the room, leaving the sound of the returning beeps behind her. The hallway outside Trauma 1 smelled sharper than the room she had left. Fresh disinfectant, fresh air from a vent, fresh voices already rising again. Riley walked until the noise behind her blurred into the general hospital hum. She turned in her badge at the charge desk without argument. The charge nurse frowned, a deep line forming between her brows. He really pulled you, the nurse said. Looks that way, Riley said. You want to talk to Staffing Heart or legal or somebody? Riley shook her head. Not today. She left the badge on the counter. It looked small without the weight of her on the other end of the clip. In the locker room, she changed slowly, folding her scrubs with the same care she used for instruments, as if order might keep the day from unraveling further. Her street clothes felt wrong after so many hours in cotton and paper. Denim seemed heavy at the knees. The fabric of her shirt scratched at the inside of her elbows where the tape had been. At the sink, she scrubbed her hands again, even though the blood was gone. Water hissed over her skin. The scar on her forearm shone white for a second under the fluorescent lights. She turned off the tap and watched the drops fall into the empty basin. Her reflection in the dull metal of the paper towel dispenser looked like it belonged to someone else. Someone who had done what she did in that room and then walked away when told. She dried her hands and tossed the towel into the trash. Outside Trauma 1, the scene had shifted. The patient she had cut into was now a man with a tube at his throat, breathing in time with the ventilator, his chest rising more easily. Leah adjusted the settings and glanced at the numbers. Oxygen saturation back in the 90s. Heart rate steady enough. Cole stood at the foot of the bed with his arms crossed. You have to file an incident report, he said. Leah did not look up. What are you going to write in it, she asked. That your nurse saved his airway when you were chasing the wrong collapse. That my nurse performed a surgical procedure without authorization, Cole said. In front of staff. in violation of every protocol we have. Leah checked the placement of the tube and taped it more securely. He would have died, she said. Maybe, Cole replied. Maybe not. But I am the attending. It is my call. It cannot be like this. This is not Kandahar or Fallujah or wherever she learned that cut. This is a hospital. There are rules. Leah's jaw flexed. Maybe that is why he is alive, she said, because somewhere else did not have time for your rules. He shot her a look sharp and close. Watch yourself, Dr. Grant, he said. You are still under me on that board. She swallowed the reply that came to mind. There were lines she could not cross and keep her badge. Noted, she said. Cole stepped out of the bay. He pulled his mask down and rubbed hard at the bridge of his nose as he walked. A few nurses watched him pass and then turned back to their tasks. Leah followed at a slower pace. In the residence lounge, she dropped onto a plastic chair and stared at the wall for a long moment. The clock above the microwave ticked softly. Someone had left a half-eaten sandwich on the counter. The smell of mustard and stale bread sat in the air. She pulled her laptop closer and opened it. Hospital login, staff directory H for Hart. The screen filled with a small profile. Riley Hart, registered nurse, hired 18 months ago, no photo beyond the same generic headshot they had taken for everyone on orientation day. Previous employment field blank. Leah frowned. She clicked through to certifications. All current, advanced cardiac life support, trauma nursing. Nothing unusual for someone in this wing. She opened a browser tab and typed the full name. Dozens of Hart hits that were not her. She added RN Phoenix and got a LinkedIn for a different woman with the same name in another state. She added Riley Hart MD and watched the search narrow. One article caught her eye. It was not a big site, more of a rehost from somewhere else, but the headline sat like a heavy weight. Army trauma surgeon under investigation. After Helmand convoy blast. Leah clicked. The text loaded with several black bars where names should have been. Dates and locations showed through. Helmand Province, forward operating base, convoy hit by an improvised explosive device. Multiple casualties, 3 local children with shrapnel wounds, 2 American contractors private security critical. The surgeon was named in one line. Major Riley Hart, 8 years of service. Multiple commendations. Investigation pending regarding triage decisions. Leah scanned the words. None of them explained what had actually happened. None of them said she had done anything wrong. They did not have to. The implication hung between the lines. She sat back in her chair and pressed the heels of her hands into her eyes. In another part of the hospital, Riley took the long way to the exit. She passed radiology, where techs sat behind thick glass, and pharmacy, where a technician labeled vials with neat handwriting. She moved through the main waiting area, where families hunched over their phones and coffee cups' faces turned toward the reception desk, even when nothing moved there. A child's toy car lay on its side under one of the chairs, a bright blue point of color on the gray floor. Automatic doors opened in front of her and let in the late afternoon glare. The sky above the parking lot was the kind of pale blue that would bleed into orange soon. Heat rolled up from the asphalt in faint waves. She squinted against the glare and walked toward her truck. Each step away from the building made the noise behind her softer. By the time she reached the second row of cars, she could almost pretend she did not hear the monitors, the overhead pages, the low rumble of voices. She hit the key fob. The truck chirped. The sound bounced off the concrete light poles. Her hand was on the door handle when the hospital speakers crackled. Attention, the operator said. Mass casualty incident incoming. Repeat, mass casualty incoming. Estimated 8 patients, multiple critical. All available surgical staff to the emergency department. The words carried all the way to the far edge of the lot. Riley froze. The breeze picked up just enough to nudge a stray paper cup across the pavement. Somewhere a car alarm blipped and then fell silent again. She heard the announcement a second time. The same words, the same steady tone. All available surgical staff. She exhaled slowly through her nose and stood very still, fingers still resting on the door. Inside the hospital, alarms answered the call. Beds were cleared, curtains pulled back, or schedules shifted. That rhythm she knew so well began to speed up. Leah shut her laptop without closing the tab. The same announcement filled the residence lounge. The clock above the microwave ticked on. The half sandwich sat on the counter. Leah stood up fast enough to make her chair scrape. She grabbed her stethoscope from the back of the chair and ran. In the hallway, other white coats converged toward the emergency department. Nurses stepped aside, then pivoted and joined the flow. A respiratory therapist jogged past with a ventilator. As Leah rounded the corner near the main entrance, she caught a glimpse of the parking lot through the glass. Riley stood by a dark pickup, one hand on the door, not moving. Leah changed direction without thinking. She pushed through the sliding doors and felt the heat hit her skin. The smell changed from sterile chemicals to hot asphalt and faint exhaust. She jogged across the painted lines until she was close enough to speak without shouting. "Riley," she said. Riley turned her head. The look on her face was not surprise, it was something closer to resignation. "You heard it," Leah said. "I heard it," Riley answered. "They are saying 8 patients," Leah said. 3 critical. That is just what they know about. We are short already. Cole has half the residents tied up upstairs. We need hands." Riley looked past her at the front of the hospital. The glass doors slid open and shut as staff moved in and out. Red lights from approaching ambulances flashed faintly on the far road. "I'm not staff anymore," Riley said. "You heard him. Suspended." Leah stepped closer. "Suspended or not?" "You know what that call means," she said. "You have been in the middle of one. Probably more than one." Riley's jaw tightened. For a moment, dust motes in the hot air between them looked like sand in another country. "That is a different life," she said. "Not to the people coming in those trucks," Leah said. "To them, it is the only life they are walking in with." Riley's hand dropped from the door. Her fingers curled and uncurled at her side. "You have surgeons," she said. "You have Cole. You have residents and nurses and medics. It is a big hospital." Leah let out a breath that sounded halfway between a laugh and a fight. "We have people who know the protocols," she said. "We have people who read about pileups and blasts and think it is something that happens in other cities. You are the only person here who looked at a collapsing chest today and cut where the air actually was." The wail of sirens reached them now low and distant but rising. Riley turned her face toward the sound. The light caught the side of her neck, the line of tension there. "He said this is not a war zone," she said. "He is right. It is not my job anymore." Leah shook her head. "He is wrong," she said. "About a lot of things. Whatever uniform you used to wear, you are the person I want in that room when blood starts hitting the floor." Riley looked at her. Really looked as if weighing the words the same way she weighed tissue under her fingers. The sirens grew louder. A dust devil spun up along the edge of the lot, then broke apart. "I cannot walk back in there like nothing happened," Riley said. "They would throw me out again." "We can deal with that after," Leah said. "Right now there are people who have not even arrived and they are already bleeding out in the back of a truck. You know that feeling. You know the timeline in your bones." Riley glanced down at her hands at the faint redness across her knuckles where compressions had driven them into bone earlier. The skin over the scar on her forearm seemed almost translucent in the harsh light. For a second her fingers trembled, then they went still. She pulled her keys from her pocket and pressed them into Leah's hand. "Move it if they need the space," she said. Leah stared at the keys. "Does that mean you are coming?" she asked. Riley did not answer. She turned and looked at the hospital again. The automatic doors slid open for a nurse pushing a wheelchair, then closed behind her. Riley took one step toward the entrance, then another. At the edge of the curb, she stopped. From inside, a different voice came over the speakers, sharper, more insistent. "All trauma base to readiness," it said. "Ambulances arriving in 2 minutes." Riley looked back over her shoulder. "Do what you can without me," she said. Then she turned away from the entrance and started walking along the row of cars, not toward the exit, yet not toward the doors, either, caught between the 2 directions, while the sirens raged closer. The sirens rolled over the parking lot in waves. Riley walked between the cars, each step slower than the last. Heat rose through the soles of her shoes. The faint shimmer above the asphalt made the ambulances on the far road look like they were floating. The first one turned into the drive lights, strobing red and white against the glass front of St. Augustine. Another followed, then another. Their engines growled low under the high wail of the sirens. Riley stopped walking. Her truck sat behind her, silent and dark. The hospital stood in front of her, bright and loud. For a heartbeat, she was back in a dirt lot half a world away, watching armored vehicles roll toward a tent that already smelled like smoke and blood. A shout cut through the noise. 2 paramedics in yellow vests dropped from the side of the lead ambulance and swung the back doors open. The metal banged against its hinges. A gurney slid down the rails. There was a glimpse of clothing torn dark with blood, a flailing hand and neck brace. Multiple vehicles, one of the medics called toward the entrance. "Highway pileup. We have no idea how many yet." The automatic doors parted. Staff poured out. A respiratory therapist pushing a portable ventilator. A tech with a stack of monitor cables over his shoulder. Cole near the front already snapping gloves on his face set. He saw Riley. For a fraction of a second their eyes met. His expression did not change. He turned away barking orders. "Trauma 1 through 4 are ready," he said. "Leah, you are bed 1. Park bed 2. Desai bed 3. Vega float. I want every stable patient out of the main bay now." Riley watched them swarm the first stretcher. The patient on it was a woman in her 30s, conscious hair matted with blood. A neck collar held her head rigid. Her left leg lay at an angle that did not match the rest of her. She moaned once, long and thin. Leah took the head of the bed. She held the woman's gaze and spoke low while they rolled her inside. The second ambulance doors opened. A teenage boy with glass embedded in his cheek and forehead lay very still, eyes wide and stunned. The third gurney held an older man belly distended under a torn shirt, breath shallow. The fourth ambulance had not even stopped moving before its doors flew open. Heart. Leah's voice came from closer than Riley expected. She turned. Leah was breathing hard, cheeks flushed under the drying streaks of a previous patient's blood. Riley's truck keys were still clutched in her hand. "We are out of nurses," Leah said. "Cole just reassigned half of them to the floors to clear beds. You are going to stand here and watch them drown inside." Riley looked past her at the line of gurneys moving through the doors like a procession. "I am suspended," she said. Leah shook her head once sharp. "You are breathing," she said. "You are standing. That is what we have to work with." A siren cut off as an ambulance killed its noise and coasted into the bay. Without the wail, the rest of the sounds grew clearer. Commands, numbers, the squeak of wheels, the slap of rubber soles. Riley felt the old map come up in her mind unbidden. 8 patients, 4 bays, 2 surgeons worth trusting, time already bleeding away on the asphalt. Her chest tightened, then eased. "Where?" she asked. Leah did not smile. Relief flickered for half a heartbeat in her eyes. "Inside," she said. "We will figure out the rest as we go." They jogged to the entrance. The automatic doors opened on chaos. Every bed in sight was occupied or about to be. Nurses wrapped blood pressure cuffs and hung fluids. Techs slid crash carts into position. Someone cut through jeans with heavy shears. Someone else shouted for more O negative. Cole stood in the center of it all, trying to be both still and everywhere at once. His gaze flicked from one bed to another, prioritizing on the fly. He saw Riley and Leah come in. His mouth thinned. "You do not belong in here, Hart," he said. "You were told to leave the building." Riley did not slow. She stopped just close enough that he had to look directly at her. "You need hands," she said. "I have them." "I have staff," Cole replied. "You are suspended. I am not debating this in the middle of my trauma bay." Behind him, a paramedic called out vitals in a rush. Male 16 unrestrained passenger. GCS 13 possible concussion, deep lacerations to the scalp and cheek. Stable for now. Leah had already peeled off, moving to the teen's bedside. Another gurney rolled in. The older man with the swollen belly grunted with each bump. "Male, early 60s, the medic at his side said. "Abdominal trauma, rigid distended. Hypotensive in transfer." Cole hesitated. He looked at Riley at the beds filling fast, at the line of stretchers still forming in the ambulance bay. He made a choice. "Fine," he said. "Bed 4. You take the least critical patient, and you do not lay a hand on anyone else without my explicit say-so. You speak when you are spoken to and not otherwise." "Clear," Riley said. He pointed. "Forearm fracture," he said. "Young male, stable vitals. Triage says he can wait." Riley moved. Her assigned bed held a man in his early 20s, face gray with shock but eyes alert. His right arm was wrapped in a field splint from wrist to elbow. Blood had soaked through the cloth in a long dark stripe. "Name?" Riley asked, already reaching for gloves. "Luis," he said. "It just hurts. I am fine. Help them first." He nodded toward the rest of the room. "We are helping all of you," Riley said. "You are not nothing in this pile." She checked his radial pulse, firm and quick. Skin cool, but not clammy. Respiratory rate fast, but not gasping. No obvious chest or belly injury. The splint hid the mess beneath, but the bleeding had slowed. "We will get x-rays," she said. "Right now I'm making sure the rest of you is not lying to me." She ran a quick scan, pressing along ribs, watching his face for flinches. He hissed when she touched his right hip, but shook his head. "I slammed into the console," he said. "It is bruised. I can move my toes." He wiggled them to prove it. She nodded. "Good sign," Riley said. "You get to complain about the cast later." He nodded back, jaw clenched. At the next bed, Leah spoke in a low, steady voice to the teenager with glass in his face. Priya hovered near the older man with the rigid belly, eyes wide, as she pressed gently into the distended skin and felt the board like resistance. "Fast exam, Priya," Cole said as he rushed past. "We need to know if he is bleeding out into his abdomen or if it is just bruising." "Yes, doctor," she said. Jordan slipped between beds, helping where there were gaps. She handed gauze, stabilized necks, adjusted oxygen masks. Every few seconds, her eyes returned to Riley as if checking that she was still there. 2 more ambulances backed into the bay. The intercom crackled overhead. "Trauma Bay 5 opening," someone said. "Overflow into minor care is needed." A nurse hustled a stable asthma patient out of a bed and into a hallway chair to make room. The air smelled like blood and antiseptic and the kind of fear that no one named out loud. Riley finished her rapid exam on Luis and taped fresh padding over the splint where the blood had seeped through. "You are holding your own," she said. We will get you imaging when the rush thins. He tried to smile. I am not going anywhere, he said. She patted his uninjured shoulder once and stepped back, letting a tech slide in to connect him to a monitor. At the far end of the bay, one of the new gurneys came in hot. Female 42, the medic called. Blunt chest trauma from steering wheel. Paradoxical chest movement. Suspected flail segment sats dropping. The woman's chest rose in a broken pattern. A section over her ribs moved in while the rest moved out while the rest moved in. Every breath looked like it might be her last. Trauma 2, Cole said. Vega, you are on that. Get a chest x-ray and set up for possible intubation. Jordan nodded and peeled off in that direction, hands already reaching for the airway cart. The last ambulance in the first wave rolled to a stop. Its doors opened more slowly. A paramedic in a sweat-soaked uniform stepped down and wiped his forehead with the back of his wrist. He looked exhausted in a way that had nothing to do with the heat. We have one more from the same pile, he said. Driver of one of the vehicles, male, late 50s. Complained of chest pain at the scene. Lost consciousness on the ground. He tapped the side of the gurney. The man on it wore a white dress shirt, now open down the front, the fabric stained with sweat and a few drops of blood from a small cut at his hairline. His hair was short and iron gray. His jaw was set even in unconsciousness. An oxygen mask fogged with each shallow breath. On his left shoulder, the torn remains of a jacket showed a patch with a familiar symbol. An eagle spread its wings over a silver bar. Colonel Daniel Harlow, the medic said. Active duty. He was at the edge of the pileup, directing people away when he dropped. We got a weak pulse back in the rig. He is hypotensive and he keeps trying to go funny on us. Funny how Leah asked, Yak meeting them at the door. Rhythm kept wanting to tank, the medic said, like he was flirting with arrest and then changing his mind. No obvious external bleeding, no chest bruising like the others. We could not get a good listen with all the noise. Cole stepped in. Trauma 3, he said. He is mine. Leah, you stay with the belly. Park, you can assist me once you have that kid's head wrapped. The medic rattled off numbers as they rolled the colonel toward the empty bed. Blood pressure hovering around 70/40. Heart rate around 140. Respiration shallow. Riley watched from the space between her patient and the hall. The rank on the torn patch pulled at something in her chest. Colonel. Age, build, bearing, all said career. The kind of man who lived on orders and maps, and the expectation that people would follow him. He looked smaller on the gurney. The monitor clipped to his finger showed a heart that was still working too hard and still losing ground. Oxygen saturation sat in the mid-80s and kept trying to sneak lower. Cole moved to the colonel's side stethoscope already in hand. Neck veins are distended, he said. Heart sounds are muffled. Pressure is in the tank. Could be cardiogenic shock, could be tamponade. Get an echo in here now. A nurse ran to fetch the portable ultrasound. Riley's hands curled at her sides. She knew those signs. She had seen them in a tent in a helicopter in the dirt beside a broken wall. Blood trapped where it should not be, drowning a heart that did not have space to beat. She glanced at Luis. His monitor numbers stayed solid. The tech at his side had things under control for the moment. The colonel took a shallow breath that hardly moved his chest. A soft sound came from his throat like a half-swallowed word. Riley took 2 steps toward his bed before she realized she had moved. Cole's voice reached her without him looking up. Stay with your assignment, Hart, he said. I have this. She stopped. The ultrasound cart rattled in a blur of gray wheels and wires. The screen lit up with a grainy image of a beating heart surrounded by a dark halo. Riley waited at the edge of the space just outside the circle of light, watching and listening, her body leaning forward a fraction as if some part of her was already at the colonel's bedside, whether she meant it to be or not. The ultrasound image jerked into focus in shades of gray and black. Cole held the probe in one hand, his other hand braced on the edge of the bed. The colonel's heart filled the screen, squeezed inside a dark crescent of fluid that pooled around it like a shadow. There, Cole said. Pericardial effusion, big one. The nurse beside him swallowed. Tamponade, she asked, too. Oop, she asked. Looks like it, Cole said. Explains the hypotension. Riley watched the picture. Each beat was small and cramped like a fist trying to open inside a glass jar. The dark rim did not move. It just waited. Blood where it should not be. Cole handed off the probe. Pericardiocentesis kit, he said. Now. The nurse hurried to the supply cart, grabbed a wrapped tray, and slapped it down on the bedside table. Plastic cracked as she tore it open. A long needle, a syringe, tubing, antiseptic gauze, metal and plastic in clear lines. Riley's fingers twitched. She stayed where she was. Cole snapped on a fresh pair of sterile gloves. His jaw was set. He wiped betadine over the skin just below the colonel's sternum and palpated the ribs. Under the xiphoid, he said under his breath, up toward the left shoulder. Riley heard the words, heard the cadence of someone reciting a step he knew from textbooks more than from repetition. She moved one step closer. Fifth intercostal, she said quietly, angle shallow. Cole did not look at her. Thank you, heart, he said. I am familiar with my own heart. He picked up the needle and attached the syringe. The metal shone in the overhead lights. For a moment, his hand hovered over the colonel's chest, searching for the right landmark. The colonel's neck veins stood out like cords. Sweat slicked the skin at his temple. His lips had taken on a faint blue tint. On the monitor, the heart rate climbed to 150. The blood pressure dropped another notch. Move, Cole said, if you are not helping get out of my line of sight. Riley stepped back half a pace, not enough to be gone, enough to avoid his direct glare. He inserted the needle beneath the sternum and pushed. The skin dimpled, then gave. The colonel's chest heaved slightly. The monitor spiked. The rhythm jumped into a wild pattern for 2 beats and then slammed back weaker. Cole exhaled through his teeth and pulled the needle back a few millimeters. He adjusted the angle deeper this time and pushed again. No blood entered the syringe. He frowned. Nothing, he said. I am not in the space. Suction. He withdrew the needle completely and stared at it for a second, then reset his position. Try lateral, Riley said. Closer to the apex. You will have more clearance. Cole pretended not to hear her. He moved to the left a little, found the 5th rib, and slid into the intercostal space. His hand trembled just enough that Riley could see it. The needle advanced. The colonel's eyes fluttered under closed lids. His fingers twitched against the sheet. On the monitor, the green line stuttered in a way Riley disliked. The peaks grew closer together, then farther apart. Come on, the nurse with the blood pressure cuff whispered. Hold it together, sir. Cole pulled back on the plunger. Nothing again. He pushed a hair farther. The heart on the screen jerked. The rhythm snapped into chaos, jagged and uneven, then stretched into a flat line. The monitor gave a single long tone. For a second, no one spoke. Lost pulse, Leah said. Her voice was flat in the middle of the noise. He is out. Check leads, Cole barked. Check the connections. It could be artifact. Jordan had already reached for the colonel's neck. Her fingers pressed into the carotid groove. Nothing, she said. No pulse. The long tone from the monitor filled the space. The nurse called out readings that did not change. Pressure unmeasurable, oxygen saturation dropping, heart rate 0. Cole stared at the needle in his hand, then at the screen. Start compressions, he said. Get the crash cart ready. Leah moved to the side of the bed, hands poised over the sternum, waiting for someone to tell her to begin. Riley stepped forward. Let me take the next attempt, she said. You are not in the SAC. You are irritating the myocardium. We do not have time for more practice. Cole turned his head slowly to look at her. You are done here, Hart, he said. His voice shook underneath the control. You were already told to stay in your lane. You are not authorized for this procedure. You are not authorized for this patient. The monitor kept screaming. Riley looked at it once, then back at him. He is in cardiac arrest from tamponade, she said. If we do not get that blood off his heart, compressions will not bring him back for long. You know that. I know that you are not touching this man again, Cole said. If you do, I will have security drag you out of this bay. I will make sure you never see the inside of an operating room in this city again. He lifted the needle, set his jaw, and started to reposition. Riley moved. She stepped into his space close enough that the sleeve of her scrub top brushed his gown. Her hand closed gently but firmly around the hub of the needle. Step away, doctor, she said. Her tone was soft, but it held no room. Cole's face flushed. Let go, he said. That is an order. Riley met his eyes. Then arrest me after I save him, she said. There was no drama in the words, no challenge, just a statement of sequence. Around them the room had narrowed. Priya stood frozen near the foot of the bed, bag of fluids in one hand, tubing dangling. Ethan watched from the doorway, mouth slightly open. The nurse with the blood pressure cuff had stopped pumping. Jordan watched Riley's fingers on the needle like she was watching a fuse being lit. No one called for security. Riley eased the needle out of Cole's grip. Her fingers seated along the barrel with the familiarity of someone holding a tool she had used many times before. She moved to the left side of the bed, her hip bumping the tray, and set her fingertips on the colonel's chest. She found the 5th rib slid into the space just below it, aiming toward the left shoulder. Echo, she said. The tech pulled the image back onto the screen. The heart floated in its black pool, still and silent now. No motion, no squeeze. Riley did not need the picture. She wanted it anyway. She advanced the needle, slowly feeling for the slight resistance of tissue layers, the subtle give as she slipped between them. The room held its breath. There was no flash of drama when she reached the space she wanted. There was only a small softness and almost imperceptible pop in her fingertips. The syringe began to fill with dark blood. Got it, Jordan breathed. Riley pulled gently. 10 milliliters, 15, 20. Each draw took pressure off the sac. Each draw gave the heart a little more room if it still cared about room. The monitor remained flat. Heart, Cole said. He has been down nearly 8 minutes. This is a corpse. You are draining a corpse. Riley did not answer him. She watched the syringe. At 40, she stopped. Bag him, she said. Jordan already had the bag valve mask in place. She squeezed. Air moved into the colonel's lungs. His chest rose under the drape and fell again. Riley withdrew the needle in one smooth motion and dropped it into a metal basin. It clinked against the steel. Then she set her hands over the colonel's sternum and started compressions. The long tone of the monitor cut out when the gel electrode slipped slightly. The sudden silence was almost worse. Someone adjusted the lead. The flat line came back. Riley pressed down. Her palms drove through bone and cartilage with measured force. She counted in her head. Not numbers. Pattern. 30 compressions. Pause. 2 breaths. Repeat. Air from the bag whooshed with each squeeze timed with her rhythm. The colonel's head rolled slightly with the movement. His face stayed slack. The dog tags that had been cut from his neck lay on the counter by the wall, ringing softly when someone set a tray down too hard nearby. Time from arrest, Leah asked. 8 minutes, 30 seconds, someone answered. Cole hovered at the edge of the bed, arms rigid at his sides. He looked at Riley's hands as if they were doing something obscene. After 10 minutes without return of spontaneous circulation per our protocol, we terminate resuscitation, he said. Protocol is for people whose hearts are not trapped inside a box, Riley said. Her breath came even, not yet strained. He did not have circulation before. He has a chance now that the tamponade is relieved. She pressed again. Her shoulders stayed stacked above her wrists. Her elbows did not bend. Each compression sank 2 inches and released. 10 minutes, Cole repeated. You are only prolonging the inevitable. Riley did not look up. In Hellman, she said we had a 16-year-old whose truck rolled onto an IED. He was down at least 12 before he reached us. We cut his chest open on a metal table and pumped his heart with our hands. He walked out 6 weeks later. This is not Hellman, Cole said. Riley pressed harder. Tell that to his heart, she said. 9 minutes, 10. Jordan's shoulders ached from squeezing the bag, but she did not stop. Leah kept one eye on the monitor, one on the clock. Oxygen saturation, which had dropped into the 60s, crept up into the 70s. The line on the screen stayed stubborn and straight. 11 minutes, Leah said softly. Ethan shifted his weight from one foot to the other in the doorway. He had never seen anyone push compressions this long in real time. In training videos, it always cut away. Most outcomes are poor after 10, Priya whispered. Most outcomes, Leah said. Not all. Riley's face had a sheen of sweat now. A damp curl of hair stuck at her temple. Her expression did not change. She pressed, she released, she waited. Her hands did not tremble. 12 minutes, someone said. Cole opened his mouth, closed it. His arguments had started to sound thin, even to himself. Riley felt for any change under her palms. A twitch, a pushback, anything. There was nothing. She pressed again. Come on, she said. The words were almost lost under the noise. You have work left, remember. 13 minutes. The room around them had gone quiet in a way that did not match the number of people in it. The other trauma bays still moved, still bled, still cried out, but here in this small circle the only sound was hands on bone and the regular hiss of the bag. The flat line held. Riley stopped. Jordan froze with the bag halfway squeezed. For a second it looked like she was giving up. Riley shifted her hands to the colonel's neck. Her fingers pressed into the carotid groove where a pulse should have been. Nothing. She moved her fingers slightly, checked again. Still nothing. Cole watched her. Heart, he said. Enough. Riley placed her hands back on the sternum. Not yet, she said. She started compressions again a notch deeper. 14. The monitor flickered once so fast that most of the room missed it. A tiny spike in the quiet line. Jordan saw it. Wait, she said. Did you see that? Riley did not stop. The line bumped again. A small hump, then another. The machine hesitated, caught, and drew the next beat a little taller. The flat tone broke into a stuttering series of beeps as the rhythm organizer inside the box tried to understand what it was seeing. Ventricular escape, Leah said, or something like it. Check a pulse, Cole said. Riley was already shifting again. She pressed 2 fingers into the colonel's neck. For a moment, there was only the phantom throb of her own blood in her ears. Then faint under her touch a flutter. Carotid pulse present, she said. Weak, irregular. The monitor agreed. The messy bumps settled bit by bit into something that looked like a sinus rhythm that had been through a fight and come out limping but upright. Oxygen saturation ticked up, 78, 82, 87. Riley exhaled once long and controlled. Get a norepinephrine drip started, she said. Low and slow. Keep his pressure just enough to perfuse. Order a stat CT head and chest. Page cardiology. There was no hesitation in her tone. The words came like steps she had walked many times. Staff moved. The spell over the room seemed to break. The nurse with the blood pressure cuff pumped again. Another nurse adjusted the oxygen. Jordan secured the airway more firmly. Cole stood still for another second while the scene rearranged around him. He looked at the monitor, at the climbing numbers, at the man on the bed, who by all logic should not have come back so far gone. He looked at Riley. "How did you know not to stop?" he asked. Riley kept her eyes on the colonel as she adjusted an IV line. "I did not know," she said. "I just was not done yet." The monitor beeped now in a pattern that belonged to the living. The colonel's heart kept up its uneven climb towards something steadier. Beep, beep, not pretty, not strong, but present. Riley pulled her hands away from his chest and let someone else slide in to attach more leads. Her shoulders ached. Her palms tingled with the echo of compressions. Sweat cooled on the back of her neck. A nurse hung the norepinephrine drip and adjusted the roller. Leah checked pupil response with a pen light. The colonel's eyelids fluttered, then stilled again as if the body was taking inventory before deciding how awake it wanted to be. "Pressure is 80/50 and rising," the nurse said. "Oxygen 91. Someone clapped once quietly, like they did not mean for it to be heard. The room shifted in a subtle way, as if the floor had tilted back to where it belonged. Cole cleared his throat. "All right," he said. "Get him to CT with monitors and a nurse who knows what they are doing. Then a bed in the ICU as soon as they clear him. Tell cardiology I want an attending, not a fellow. I need another set of senior eyes on this." He spoke to everyone at once and no one in particular. He did not look at Riley when he said it. Leah nodded and started directing the transfer. Wires and lines were gathered with practiced hands. The bed rails came up with a click. The colonel's dog tags stayed on the counter for a second too long before Jordan scooped them up and set them gently on the sheet beside him. Riley stepped back from the bedside until she hit the cabinet behind her. The cool metal against her spine made her shiver. Her hand still felt the shape of his sternum. She pulled off her gloves slowly. The latex snapped at her wrists. Her fingers underneath were pale and wrinkled. Cole turned then. "Hart," he said. "Outside now." His voice had lost some of its edge, but not enough. Riley glanced once at the colonel as they wheeled him out. His face looked less gray now. His chest rose in time with the ventilator. The monitor traveled with him, its beeps fading down the hall. She followed Cole into the hallway. The air out there was only slightly cooler, but it felt colder all the same. Cole stopped near a supply closet and faced her. His mask hung around his neck, now pulled loose. Lines had carved themselves deeper at the corners of his mouth. "You do not get to keep doing this," he said. Riley met his gaze. "Saving your patients?" she asked. "Breaking chain of command," he said. "Taking knives out of my hand. Cutting necks and hearts that do not belong to you." Riley felt the sting of skin under her nails as her hands curled. "He is alive," she said. "He was dead. Now he is not." Cole closed his eyes for a moment. "Because you ignored an attending," he said. "Because you made a call that was not yours to make. This is not a field hospital. There are licenses and privileges and liability. You cannot just walk into my bay and act like my equal when you are hired to be a nurse." He took a breath that rattled in his chest. "Your suspension stands," he said. "You hand in your badge, you are off this floor, there will be a review. Until then, you do not touch another patient here." He walked away before she could answer. She watched his back as he moved toward the admin wing, his shoulders tight. A nurse stepped aside to let him pass, then glanced back toward Riley with a look that was hard to read. In the residence lounge, Leah sat in front of her open laptop again. The article about Hellman still stared back at her with its half-redacted lines and careful phrases. "Investigation pending. Questions regarding triage decisions." She could hear echoes in the hallway of what had just happened in Trauma 3. She could see Riley's hands on the colonel's chest in the reflection on the dark screen. Jordan burst in without knocking. "You saw that right," she said. "You were there when she brought him back?" Leah nodded. "I was there," she said. Jordan dropped into the chair opposite her. Her scrubs had a smear of dried blood on the thigh. Her hair had escaped its tie and curled damply at her neck. "She did a battlefield pericardiocentesis," Jordan said, "in a civilian trauma bay, with you and Cole watching. I have only ever seen that on a training mannequin, and the mannequin never scared me like that." Leah turned the laptop so Jordan could see the headline. "Does that name look familiar?" Leah asked. Jordan leaned forward. Her eyes scanned the words, then went back to the photo. "That is her," she said. Same eyes, less tired. She read the article twice, jaw tightening. "They hung her out to dry," Jordan said. "Whoever wrote this, they wanted people to think she killed someone by choosing the wrong patient." Leah shut the laptop with more force than necessary. "She chose someone today," Leah said, "and he is upstairs breathing." They sat in silence for a moment. "Cole is still suspending her," Leah added. Jordan stared at the closed laptop. "Of course he is," Jordan said. "He does not know how to handle someone who makes him look small." In the locker room, Riley moved through the motions again. Scrubs off, street clothes on, hands under hot water until the skin flushed pink. The scar on her forearm felt raised to her own touch, even if it did not look that way. Her fingers shook when she reached for the paper towels. She paused and pressed her palms against the cool metal sink for balance. The echo of the monitor's flat line sat behind her eyes, the memory of its return pressed against it. Both sounds layered out of sync, refusing to cancel each other. She dried her hands and left the room. The route to the exit felt at once familiar and strange. Every step she took carried her past people she had worked beside for 18 months. Some of them nodded, some did not look up. None of them knew what her name had been before she pinned on the RN badge. The automatic doors opened. Outside, the sky was sliding from late afternoon into early evening. The heat had softened a little. The parking lot was still warm enough that the air above the pavement shimmered in spots. Riley walked to her truck and climbed in. She shut the door and sat there without starting the engine. The cabin smelled faintly of dust and coffee. A worn map of Arizona lay folded on the passenger seat. Her hands rested on the steering wheel. They began to shake. Not a little tremor. A full fine rattling that ran from fingertip to elbow. Her breath shortened. The cab seemed to close in by half. She closed her eyes. In through the nose. Hold, out through the mouth. She counted breaths until her fingers settled one by one. The shaking did not stop entirely, but it dulled to an internal tremor. Her phone buzzed in her pocket. She ignored it. It buzzed again, then again. She pulled it out and glanced at the screen. Unknown number. Hospital main line. Leah. She let them go to voicemail. A text came through. From an unsaved number. Colonel Harlow made it to CT. No neurodeficits so far. Vitals improving. That was not luck. We should talk. Riley stared at the message until the screen dimmed. She deleted it. The phone buzzed again almost immediately. Another text. You saved him, Riley. Whatever happened in Hellman, that was not it. Please call me. Riley deleted that one too. She turned the key in the ignition. The engine coughed and then settled into a low hum. The dashboard lights came on, washing the cab in a dull orange glow. She shifted into reverse. The phone rang again. This time the display showed St. Augustine's switchboard. She let it ring until it stopped. She backed out of the parking space and pulled toward the exit. Headlights appeared in her rearview mirror. A compact sedan, dark blue, followed at a respectful distance. She turned right at the light. The sedan turned right. She drove 3 blocks to a gas station on the corner, pulled into the lot, and parked beside an empty pump. The sedan swung in behind her and came to a stop. Riley sighed. She killed the engine, got out, and waited. Leah climbed from the driver's seat of the sedan. She wore a thin jacket over her scrubs, as if that could hide the bloodstains, and the hospital ID still clipped to her collar. Her hair had frizzed at the edges in the heat. You are following me now, Riley said. Yes, Leah said. That is not really encouraged, Riley said. There are stalking laws. Leah walked closer, stopping a few feet away. So is throwing out the only surgeon in the building who can drag a dead colonel back across a line everyone else already stepped away from, Leah said. Riley looked toward the street. Cars slid past their tires, making a soft hiss on the pavement. The gas station lights buzzed overhead, drawing moths to throw themselves against the glass covers. I'm not a surgeon here, Riley said. I am a nurse who no longer works at your hospital. Leah held up her phone. You were a surgeon there today, she said. And in Helmand, and probably in a dozen other places there are no articles about. Riley's eyes flicked to the phone, then away. You read one headline, Riley said. You think you know what happened. Leah shook her head. I did not just read the headline, she said. I read the piece. All the parts they did not black out. I know there was a convoy. I know there was a blast. I know there were 3 local kids and 2 American contractors. I know the contractors died and the kids lived. I know someone decided that was your fault. She took a breath. I also know what I saw today, she said. You looked at a flat line and at a heart drowning in its own blood and decided you were not done. You were right. Riley leaned against the side of her truck. Streetlight bled a pale circle onto the ground around them. In Helmand, Riley said we had 1 table that did not wobble and 3 that did. We had 2 ventilators and 10 people who needed air. We had 4 surgical sets that were not bent. That day the convoy hit, we had all of that, and we had luck. The kids came in first, shrapnel bleeding but nothing we could not reach. She looked at her own hands, then the contractors, she said. Bilateral femoral amputations from the blast. Blood soaked into the dust before they even got through the flap. Skin cold above the knees. No distal pulses. Pressure bags wide open on both arms. Their eyes on me. Leah listened without interrupting. They asked me to save their men first, Riley said. They spoke English. The kids cried in Pashto. The translators tried to keep up. I had one team I trusted on my best day and two more who were still learning how to hold a clamp. I could split them and lose everyone, or I could put my best people where the odds were higher. Her voice did not rise. If anything, it grew flatter. I chose the kids, she said. She looked up at the gas station sign like it might be a different flag. We amputated what we had to. We tied off vessels. We pumped warm fluids and squeezed tiny hearts through shock and infection. All three of them walked out eventually. They waved goodbye at the wire. The contractors died on cold metal under bright lights. They died with my people doing compressions and calling out drugs in English. Her fingers dug into the metal of the truck. In the hearing, she said they asked me why I chose foreign children over American lives. They asked me if I understood loyalty. They asked me if I remembered who I wore a uniform for. Leah's throat worked. What did you tell them? She asked. Riley closed her eyes for a second. I told them I triaged, she said. I told them I chose the patients who had a chance, not the ones who were gone and everything, but the way the monitor looked. They did not like that answer. She let her head rest back against the truck window. They could not court-martial me without admitting where those contractors were and what they were doing, she said. So they offered me a deal. Resign quietly, keep my license, disappear, let the story sit on my shoulders so they did not have to explain it to anyone's family. The sound of a car pulling up at another pump filled the silence that followed. A man got out, swiped his card, and never looked over. Leah stepped closer. You took it, she said. I took it, Riley said. I came home. I picked a place where no one would ask why I was not still in uniform if I put on scrubs instead. I promised myself I would not make that kind of choice again. Leah looked at her. You made a choice today, Leah said. Riley huffed a breath that might have been a laugh if there had been anything funny in it. I did, she said. He was right there. So was the needle. I am not built to stand still while someone dies in front of me when I can reach them. Her phone buzzed again. She frowned and checked the screen without thinking. This time, the name on it was one she recognized. Leah's. She had typed while they spoke. Colonel is asking who saved him, the text read. He is awake now. No deficits. Wants to talk to you. Riley put the phone back in her pocket. He will thank you, Leah said. You will shrug and say it was a team. You will mean it. It will not change that he is breathing because you ignored a protocol that would have made him a statistic. Riley shook her head. I am not going back in there, she said. Cole made that clear. So did the Army. I am done being the person everyone points at when the math does not feel good. Leah's phone chimed. She glanced at it, then went very still. What Riley asked. Leah looked up. That was the ICU, she said. They are calling a code blue on the colonel's room. He is in ventricular fibrillation. They are shocking. It is not converting. The gas station sounds sharpened for a moment. The squeal of a child in the back seat of another car. The click of a gas pump shutting off. The flap of a receipt printing. Riley straightened away from the truck. How long, she asked. They did not say, Leah said. They just wanted to know if Cole was still in the building. Riley opened her truck door. Get in your car, she said. Do not drive slow. She slid into the driver's seat and turned the key. The engine caught. Headlights cut across the lot. Leah ran for her sedan. Riley pulled out onto the street tires, humming on the asphalt, the hospital's lights visible again in the distance. The road back to St. Augustine felt shorter. Riley drove with her hands tight on the wheel, eyes flicking between the traffic and the hospital lights growing larger ahead. Leah's sedan kept pace in her rearview mirror close enough that the twin beams looked fused. At the entrance ramp to the parking lot, Riley did not bother with her usual turn. She pulled into the ambulance bay instead, stopping just short of the doors. A security guard stepped forward, then hesitated when he saw her scrub top and the look on her face. Code blue in ICU, she said, already moving past him. Colonel Harlow. He stepped aside. Inside, the air was cooler, the lighting softer than the harsh glare of the emergency department. The overhead speaker still carried the same composed voice. Code Blue Intensive Care Unit. Code Blue ICU. Riley took the stairs two at a time. The elevator was too slow when a heart was quivering itself useless against its own ribs. By the time she reached the ICU hallway, she could hear the sounds long before she saw the room. The sharp command to clear, the dull thump of a shock, the staccato of a monitor alarm. She followed the noise. In the colonel's room, the lights were up full. The bed was lowered. The side rails were off. A respiratory therapist stood at the head, bagging through the endotracheal tube. A nurse called out rhythms and times. Another nurse pushed drugs through an IV port. Cole stood at the bedside with defibrillator paddles in his hands. His hair stuck damply to his forehead. His scrubs were wrinkled. Charge to 200, he said. The defibrillator whined as it loaded. The screen showed a chaotic line, all jagged peaks and no pattern. 200, the nurse said, charged. Clear, Cole said. Everyone lifted their hands. He pressed the paddles to the colonel's chest. The body jerked, then settled. The monitor wavered, then returned to the same wild dance. No change, the nurse said. Still V-fib. Epinephrine, Cole said. The syringe emptied into the line. 30 seconds stretched. The rhythm mocked them. Charge 250, Cole said. He saw Riley in the doorway as the machine climbed. His jaw tightened. You are not supposed to be here, he said. Neither is V-fib, Riley said. How long? 3 minutes, the nurse answered before Cole could stop her. 2 shocks, 1 EP, no conversion. Riley took in the scene in a sweep. The colonel's skin pale but not gray yet. The sweat on his forehead. The way his fingers curled slightly at his sides. The oxygen saturation numbers dropping by 1 point, then another. The way the line on the monitor crossed itself like scribbles instead of words. Amiodarone, she asked. Cole hesitated. We were about to, he said. About to does not cancel V-fib, Riley said. Get it in. She did not walk around him. She took the space at the opposite side of the bed where she could reach the colonel's chest. The nurse drew up the medication with quick hands and pushed it into the IV. A slow flush followed. 300 milligrams amiodarone given, she said. Charge 300, Riley said. Cole looked at her. This is my patient, he said. Riley kept her eyes on the monitor. The chaotic rhythm had a barely visible wobble to it now, like something underneath trying to decide whether to give up or organize. You are tired, she said. You already shocked him twice, and you had a full mass casualty on top of it. Let me read it. The machine reached its charge. The ready tone sounded. 300, the nurse said. Charged. Riley reached for the paddles. Cole did not hand them over right away. His fingers tightened on the grips, then loosened. He placed them in her hands. Riley set one paddle below the colonel's right clavicle, and the other on the left lateral chest. Her hand settled with the ease of someone who had done this enough times that her muscles knew their mark. She watched the monitor, not the paddles. For a few seconds, the line was nothing but noise. Then, under the scribbles, she saw a hint of pattern, a stutter that looked almost like something trying to fall into step. Clear, she said. Everyone pulled back. Riley squeezed the buttons. The body arched, the muscles clenched. The air in the room seemed to hold its own breath. The monitor drew a flat line for one long second that felt like a drop in an elevator. Then slowly one spike. Another. The third came a little closer to where it should have been. The fourth came closer still. The rhythm on the screen shifted into a sinus pattern, narrow and fast. 100, 110, but regular. The respiratory therapist kept bagging slower, now matching the heart instead of fighting it. Check a pulse, Riley said. The nurse at the colonel's wrist pressed her fingers down. Radial pulse present, she said. Strong, regular. Oxygen saturation crept back up. 88, 90, 93. The monitor's alarm changed tone, then silenced itself, no longer triggered. The room exhaled all at once. The nurse with the drug chart leaned back against the counter for a second, then straightened. Cole took a step away from the bed. Riley set the paddles back in their cradle. She touched the colonel's forehead gently with the back of her fingers. His skin felt warmer now, less waxy. Stay with it this time, she said, although he could not hear her yet. His eyelids twitched, not a full opening. Enough that she felt the smallest shift in him, as if some part of his mind had hurt anyway. Convert to maintenance infusion, Riley said. Keep him here. No more singeing his heart unless the rhythm gives you no choice. The ICU attending had arrived in the doorway during the shock. She stepped in now. I am Dr. Patel, she said. I will take him from here. Riley nodded. Pressure and rhythm are back, Riley said. He had tamponade earlier. We relieved it. He coded again when his rhythm went off the rails. He does not have much reserve left. Dr. Patel looked from the monitor to the colonel's face to Riley. I heard, she said, about the tamponade and the CPR and the fight. There was no judgment in her tone, just acknowledgement. Riley stepped back to the edge of the room. Cole watched her go. Out in the hallway, the noise was more distant. The ICU did not have the constant blare of the emergency department. Its sounds were softer, more measured, but no less serious. Riley leaned a shoulder against the wall. Her legs felt a little hollow. Cole came out a minute later. He stopped a few feet away from her. For once, he did not look like he knew exactly what he wanted to say. You keep doing that, he said finally. Walking into rooms you are not supposed to be in and keeping people from dying in front of me. Riley tilted her head. You are welcome, she said. He let out a breath that sounded closer to a sigh than anything else. You are also making my life very difficult, he said, for the record. Paperwork is easier than funerals, Riley said. Cole huffed something that might have been a laugh if it had carried more warmth. I was not in combat, he said abruptly. Riley blinked. I know, she said. I checked your record before I signed on. He looked surprised. You did, he said. Anyone who advertises their deployment as loudly as you did during my interview usually did not see much beyond the base fence, Riley said. Soldiers who saw enough do not tend to lead with it. Color rose in his face. I did my time, he said. I did not say you did not, she said. I am saying you spent it far from where I did. He stared at her for a moment, then looked away. In Germany, he said, on a base that never took a single incoming round, I patched up training injuries and car wrecks. I came home and let people think I had seen more because it made the stories easier. It made the authority easier. He rubbed a hand over his face. Then you walked in with those hands, he said. And those reflexes, and that scar. And you made calls I have only read about in case reports. He met her eyes again. Part of me resented you, he said, for being the thing I had pretended to be. Riley studied him. And the other part, she asked. The other part watched you crack a neck open at the right place without flinching, he said, and watched you pull a colonel's heart out of a vice that I could not navigate. That part is very aware that this hospital has been punching above its weight because you chose to sit behind a nurse's station instead of the surgeon's board. He straightened a little as if coming to a decision. The administration wants to talk to you, he said. They know what happened downstairs. They have already heard about upstairs. Word moves fast when a man with eagles on his shoulders flatlines twice and walks away the same night. He took a breath. They want to offer you chief of trauma, he said. If you want it, I told them I would step down. Riley let the words hang in the air. Chief of trauma. A title, a desk, a stack of committees, a shield and a tether. I do not want your job, she said. Cole looked as if he had expected that answer and still flinched when he heard it. You do not, he said. I do not want to spend my time in meetings, Riley said. I do not want to fight budgets. I do not want to argue about bed counts when someone is bleeding on the floor. She looked down the hallway toward the elevators that would carry patients away from trauma and toward recovery. I want to be in the room when they roll in, she said, and I want fewer people in that room to freeze when a monitor goes flat. Cole stayed quiet. I will stay, Riley said, on conditions. He nodded once. Name them, he said. Lead trauma surgeon, she said. I run the bays when it counts. I answer to the same committees you did, but I do not wear your lapel pin. He waited. And I build a training program, she said. Combat medicine principles for civilian teams. Residents, nurses, paramedics, anyone who will ever stand between a patient and a coffin. We train them until pericardiocentesis is not a ghost story and cricothyroidotomy is not something they only see on television. Cole considered this. Administration will balk, he said. They will ask about cost, about time, about liability. You will handle that, Riley said. You are good at committees. He almost smiled at that. Anything else, he asked. One more thing, Riley said. Jordan Vega, she's wasted as a tech. She gets a full ride to medical school or whatever loans and scholarships you can stack until it feels like one. She has the instincts. I want her in a white coat. Cole let out a breath. You are negotiating like someone who knows where the bodies are buried, he said. Riley lifted one shoulder. You know I do, she said. He shook his head, but there was a trace of respect in his eyes now that had not been there before. I will make it happen, he said, all of it. She nodded. Then you can tell administration I accept, she said. He held out his hand. For a moment she looked at it as if unsure whether to take it. Then she did. His grip was firm, a little damp, not as steady as he might have liked. Thank you, he said. Do not thank me yet, Riley said. I'm going to make a lot of people very tired. He released her hand and stepped back. You already do, he said. He walked toward the nurse's station to start the work she had just given him. Riley turned in the opposite direction. At the end of the hallway, a small sign pointed toward the chapel. She followed it. The chapel was a narrow room with a single stained glass window that let in the last of the evening light. The colors fell across the empty pews in soft stripes of blue and red and gold. Riley sat in the second row. She did not kneel. She did not fold her hands. She let her elbows rest on her knees and her fingers laced together loosely. For a minute she simply listened. The hospital's sounds came through the walls as a muted blend. The distant beep of monitors, the faint rumble of carts in the hallway, a voice over the intercom too soft to make out the words. Her palms still held the memory of bone and cartilage and the feel of a pulse returning under her fingers. She looked down at them. They were no longer shaking. 3 months later, the conference room did not look like it had ever been meant for quiet meetings. Every chair was full. Extra folding chairs lined the back wall. Nurses leaned against the doorframe. 2 paramedics in county uniforms sat cross-legged on the floor, near the front notebooks already open on their knees. At the far wall, a projector washed white light across a drop-down screen. Combat Medicine for City Streets instructor, Dr. Riley Hart. The doctor in front of her name still looked strange to her on the slide. The embroidered version on her white coat felt less so. The coat hung open over her scrubs. Her ID now read Trauma Surgeon in small capital letters. Riley stood beside the screen, hands resting lightly on the edge of the podium. She waited for the low murmur of the crowd to settle. When it did, she could hear the hum of the building behind the walls, air moving through vents, a far-off monitor, the scrape of a cart. "Good morning," she said. 50 heads turned toward her. "My name is Riley Hart," she said. "I spent 8 years as a trauma surgeon in the Army. Most of that was in places where there were no hallways and no ceilings, just canvas dirt and noise." She let the picture form for them. "In those places," she said, "we made decisions in seconds with less information than most of you get before you order an X-ray. We did not always like the decisions. We made them anyway." She clicked to the next slide. A photo filled the screen. Not of bodies or blood. A tent at dusk, light spilling from the open flap, a stretcher visible in silhouette, a pair of boots at the entrance. Shadows of people moving inside. "I am not here to tell war stories," she said. "I am here because we can use what we learned there to keep more people alive here. On your streets, in your ambulances, in our trauma bays." She let her hands fall from the podium and rest at her sides. "How many of you have watched someone die because you could not get control of their airway?" she asked. "Or because you hesitated to put a needle or a blade where you were not sure it belonged?" No one answered out loud. They did not have to. It showed in the way shoulders stiffened, in the way eyes dropped for a second. "How many of you have been in a room where everyone looked at each other for one heartbeat too long while a monitor went flat?" she asked. A few heads dipped. "That heartbeat is the one we are going to train out of you," she said. She clicked again. The image changed to a simple diagram of the human heart inside the chest. Arrows pointed to the pericardial sac. "Today we start with pericardiocentesis," she said. "Most of you, if you have seen it at all, saw it once in a live case, from the corner of the room or as a paragraph in a book. It looks like something reserved for people with extra letters after their names." She flipped to another slide, this one a list of numbered steps. "It is not magic," she said. "It is anatomy and repetition. You will not leave this room ready to stick needles into hearts on your own. You will leave this room less scared of the idea." She nodded toward the far wall. "Sim lab is set up next door," she said. "We will get there. First, we talk about why you are doing it at all, and how to listen with more than your stethoscope." A hand went up near the back. Riley pointed. The woman who had raised it wore paramedic blues, blonde hair braided tight. She looked too young to have the lines of fatigue already forming at the corners of her eyes. "How do you teach someone not to freeze?" the woman asked. "Because I know the protocol. I know the drugs." "I have still had moments where my hands did not move." Riley considered the question. "You do not teach it," she said. "Not the way you teach how much lidocaine to give or how to read a chest x-ray. You show them they can move anyway. You put a scalpel in their hand in a safe room and make them cut fake skin until their brain understands that their hands will not fall off if they do it." There was a ripple of quiet laughter. "You build a memory," she said. "So when they are standing next to a living chest, their hands remember the path even if their head is loud." She looked around the room. "That is what we are going to practice," she said. "Not bravado, not heroics, just ordinary hands doing uncomfortable things on purpose." A knock sounded at the door. It opened part way. Jordan stepped inside her white coat, buttoned a student ID hanging from her pocket that read M2 beneath her name. The coat sat a little stiff on her shoulders as if still getting used to the shape. She slipped along the wall until she reached the front. "This is Jordan Vega," Riley said to the room. "Former Army medic, current medical student. She will be your teaching assistant. She has seen more than most residents and will tell you when you are being soft." That earned another small laugh. Jordan shook her head like she did not quite agree, but her eyes were bright. "I was in Afghanistan," Jordan said. "Different base than Dr. Hart, but close enough that we heard about the surgeon who saved 3 kids when a convoy hit outside the wire. The story did not go into detail, just that she chose the cases with the best odds and that some people back home did not like the math." She glanced at Riley, then back at the crowd. 3 months ago, she said, I watched her stick a needle into a colonel's chest in this hospital when everyone else thought he was gone. I watched her do compressions until the monitors changed their mind. That is why we are here. To make sure more of you can do that when you have to." Riley picked up a remote from the podium. "In the sim lab," she said, "there are 3 stations. Pericardiocentesis on a high-fidelity mannequin, surgical airway on a neck model, needle decompression on a chest wall. You will rotate through all 3. She looked toward the doorway. "Dr. Cole will be assisting with the decompression station," she said. "Dr. Grant will run the airway station." Cole appeared in the doorway at the cue, his expression neutral. Leah stood behind him, arms crossed, a hint of a grin at the corner of her mouth. Riley clicked one more time. "The only way this works," she said, "is if you let yourself be clumsy in here. If you drop the needle in front of your colleagues instead of in front of a patient. If you feel what it is like to hesitate and do it anyway." She stepped away from the podium. "Let us get our hands dirty," she said. The group broke apart and flowed toward the adjacent room in clumps. Chairs scraped. The low murmur rose again this time, threaded with something sharper than anxiety. It sounded like anticipation. In the sim lab, plastic torsos lay on tables under bright light. The fake skin had lines drawn to mark ribs and cartilage. Screens beside them showed artificial monitors that could be manipulated to mimic arrhythmias and pressure drops. Riley moved from station to station. At the pericardial table, a resident in his first year held the needle like it might bite. "Find the rib," Riley said, standing beside him. "Count down. 5th inner space, just left of center. Aim toward the left shoulder, slow and steady." He swallowed. "What if I go too deep?" he asked. "On this one you will not," she said. "That is why we are here. To find out what too deep feels like when the only thing at stake is the mannequin's face paint." He pressed the needle in. The mannequin's monitor changed a programmed response when the sensor recognized the right position. A simulated syringe filled with dark fluid. The resident exhaled. "I did it," he said. "Now do it again," Riley said. "And again. Until your hands remember." At the airway station, a nurse with 10 years in the ER struggled to find the cricothyroid membrane on the rubber neck. "I cannot feel the landmark," she said, frustration rising. Jordan took her wrist and repositioned her fingers. "There," Jordan said. "Between that ridge and that one, flatten the skin. That is your window." The nurse nodded and made the cut. The model beeped to indicate proper placement when the tube went in. In the corner, Cole watched a paramedic perform a needle decompression. "You went too high," he said. "Drop a space. Good. Now push like you mean it." He caught Riley's eye once and gave a small nod. 2 hours later, the room smelled faintly of plastic and sweat. The garbage bin was full of used gloves. The mannequins had tiny puncture marks across their simulated chests and necks. Riley called everyone back into the conference room. Faces were flushed. A few looked wrung out. Many looked more settled than when they had first sat down. "You all did something today that most people in this hospital have never done," she said. "You put sharp things into fake bodies on purpose. You let your heart rate go up in a safe room so it will not spike as high in a real one." She scanned the crowd. "We will do this again," she said. "Not once. Not twice. Enough times that when a real heart is drowning or a real airway is closing your hands, do not wait for your fear to finish talking." She stepped back. "You can go," she said. "Or you can stay and practice on your own. The lab is open for another hour." People stood slowly, some already turning toward the door, some drifting back toward the mannequins. Jordan came up beside Riley. "You sounded like you have done this before," Jordan said. "Bits of it," Riley said, "not in one room." "You know they are going to tell other people," Jordan said. "Word will spread." "That is the hope," Riley said. She checked the clock on the wall. "I have a patient to see," she said. On the recovery floor, sunlight leaned through the windows at a late afternoon angle. The carpet whispered under her shoes instead of squeaking like the trauma bay floors. Colonel Harlow's room had a view of the distant freeway and a thin strip of desert beyond. He sat in a chair beside his bed, a blanket over his knees, a paperback face down on the table next to him. His chest rose and fell without help now. The only lines attached were an IV in the back of his hand and a nasal cannula feeding him a small stream of oxygen. 3 women sat around him, their faces different combinations of his features. The oldest with dark hair pulled into a clip, the middle one with lighter hair and glasses, the youngest with a tattoo peeking out from under her sleeve. They looked up when Riley knocked lightly on the doorframe. "Colonel," she said. He smiled, the lines around his eyes deepening. "Dr. Hart," he said. "Come in, meet my girls." He gestured. "This is Anna," he said, pointing to the oldest. "Rebecca and Jess." They stood and turned to shake Riley's hand. "We have been wanting to meet you," Anna said. "He has not stopped talking about you." Riley glanced at him. "That does not sound like something you would enjoy," she said. He chuckled softly. "Normally, I am the one telling people to stop fussing about the doctor," he said. "This time, they can fuss all they want." He reached into the pocket of his robe and pulled out a folded photograph. He held it out to her. In the picture, 5 small children posed on a dock. 2 boys, 3 girls, one with missing front teeth, one with pigtails grinning so hard her eyes were nearly closed. The background showed a lake and a fishing pole. "Grandkids," he said. "I was supposed to take that one to learn how to bait a hook next month." He tapped the kid with the missing teeth. Riley held the photo carefully. "You still can," she said. "That is what I am told," he said. "Apparently I was stubborn enough to make it worth your while." He looked at her with a steadier gaze. "They told me about Helmand," he said. "About those kids. About what they did to you afterward." Riley's shoulders tensed. "Jordan talks too much," she said. "Jordan speaks when something matters," he said. "I like that about her." He shifted in his chair. "I cannot speak for command," he said. "I cannot fix what they did. I can tell you that you made the call I would want my surgeon to make if it was my people on that table. You did it there. You did it here. I'm going to see those kids on that dock because you ignored bad optics and listened to good medicine. Riley looked at the photo again. Thank you, she said. He nodded. You are going to train a lot of people to do what you do, he said. That is what I hear. That is the goal, she said. Good, he said. The world needs more of you. I barely survived having one. I do not want to think about the statistics if you were the only one. His daughters laughed softly. Riley handed the photo back. Hang on to that, she said. Some promises should not be postponed twice. She stepped back toward the door. Get some rest, Colonel, she said. We will be ready when you start trying to do laps around the ward. He smiled again. I will hold you to that, Dr. Hart, he said. She left the room and walked back into the hallway, the sounds of the hospital wrapping around her again like a familiar song. Riley was halfway down the recovery hall when her phone buzzed. She stopped beside a window. The glass showed her reflection laid over the parking lot and a slice of desert beyond the hospital. The sky outside had shifted toward the evening clouds, catching a faint pink along their edges. She pulled the phone out. Unknown number. She opened the message. Dr. Hart, this is Lieutenant Colonel David Chen. I heard St. Augustine has you back in a trauma bay. The Army lost a damn good surgeon. Sounds like the civilians did not. For what it is worth, you made the right call in Helmand. Command got it wrong. Do not carry their mistake for them. She read it twice. Her thumb hovered over the screen. Old habit pushed her toward delete. She did not tap it. Instead, she scrolled up, saved the number, and entered a name. Chen. For the first time in a long time, the word next to it was not a knot in her chest. It was just a name. Footsteps approached. Leah came around the corner, a folder tucked under one arm, her stethoscope dangling. You walked out on my text, Leah said. I had to send a colonel to talk you into staying. He is persuasive, Riley said. He has rank. Leah tilted her head toward the phone. Another one, she asked. Old CO, Riley said. Apparently he still has my number. You going to listen to him, Leah asked. I might, Riley said, once. Leah shifted the folder. Administration loved the course number, she said. Attendance feedback the fact that the mannequins look like they survived a minor war. They want more sessions. They want data. They want acronyms. Riley raised an eyebrow. Acronyms, she asked. FEMA called, Leah said. Somebody in emergency management saw a write-up from one of the paramedics. They want to send observers. See if they can plug this into their disaster training. Riley felt a small, tight feeling in her chest, not unpleasant. That is fast, she said. A colonel dying twice in your ER will speed up a lot of requests, Leah said. So will him mentioning your name in every conversation with anyone who has a star on their shoulder. Riley exhaled slowly. And DOD, she asked. They want to talk about a bridge for medics coming back, Leah said. Take people like Jordan who lived in tents and help them not feel like aliens when they walk into tiled floors. Riley smiled small but real. Good, she said. They should have done that a long time ago. Leah looked past her through the window toward the low outline of the mountains in the distance. You know this is bigger than one hospital now, Leah said. Riley shrugged lightly. It started in one room, she said. Leah laughed softly. Softly. You in your room, she said. They walked together toward the elevator. On the second floor near the small staff lounge, Jordan stood in front of a bulletin board covered with notices. A letter was pinned there with a bright thumbtack, a printout of an email. Her name was in the middle of it. She turned when she heard them. You see this, she asked. Riley stepped closer. The letterhead at the top belonged to a medical school across town. The language was formal. The meaning was simple. Acceptance, scholarship. Jordan tapped the paper. They paid attention, she said. I did not think they would, but they did. You earned it, Riley said. You pulled strings, Jordan said. I pointed at someone already pulling their own weight, Riley said. They did the rest. Jordan looked at the letter again. I used to think I could live my whole life in a tech vest, she said. Patch people up hand tools to the real docs. I did not plan on the part where I could be one. You were already halfway there, Riley said. Now you get a coat and more exams. Jordan snorted. You going to regret this when I start arguing with you over doses, she asked. I will enjoy it, Riley said. Arguing is how I know someone is thinking. The overhead speaker clicked. Dr. Hart to conference room B, a voice said. Dr. Hart, conference room B. Leah grimaced. More acronyms, she said. Go, Riley said. You love forms. Leah rolled her eyes and headed down the hall. Jordan lingered. You get that message from Chen, she asked. You talked to him, Riley asked. He called the unit, Jordan said. Wanted to make sure we were not scaring you off the profession again. He is late, Riley said. You all beat him to it. Jordan smiled. Good, she said. We are keeping you. Riley's phone buzzed again. A simple notification from the hospital app. Training sign-ups had filled for the next month. Names she recognized, names she did not. She slipped the phone back into her pocket and headed toward the trauma wing. The air changed as she walked. The quiet of the upper floors thinned into the layered sound of the emergency department. A cart squeaked past her. A nurse hurried in the opposite direction with a stack of lab results. At the nurse's station, the board showed a cluster of names and bed numbers. Some were crossed off. New ones were written in a tight, neat script that was not hers. Cole stood there, arms folded, scanning the board. He looked up as she approached. "You are on the next trauma call," he said. "I assumed," she said. "You do not mind?" he asked. "If I minded, I picked the wrong coat," she said. He made a small sound that could have been agreement. "Patel wants to sit in on the next training session," he said. "She thinks the ICU staff should do the defib station." "That is fine," Riley said. "They were the ones with the paddles last week." He nodded. "Hart," he said. She paused. "Yes," she said. He seemed to search for something. "I'm glad you did not get in your truck and keep driving," he said. "So am I," she said. The intercom crackled. "Trauma activation," the dispatcher said. "Incoming rollover, 2 patients, 1 critical. Dr. Hart to trauma 1, Dr. Grant to trauma 2. Riley felt the sound settle into her bones. She glanced down the hall. Leah emerged from a doorway, already pulling on a pair of gloves. Jordan came from the opposite direction, tucking a pen into her pocket, hair caught back. They converged near the entrance to the trauma bays. "Roll over," Leah said. "Highway again." "Seat belts," Jordan asked. "Unknown," Leah said. "They never start with the useful parts." Riley snapped a pair of gloves from the box mounted on the wall. The latex rolled over her fingers, snug but not tight. Her hands were steady. They moved forward together. The doors to Trauma 1 slid aside as they approached. The bright lights inside washed over them. Riley stepped through. "Whoever first." "Let us get to work," she said. The monitor inside the room answered with a single, clear beep, ready to start its story again. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.